Nephritic Syndrome. Objectives: define nephritic syndrome, highlight causes of nephritic syndrome, demonstrate understanding of the pathology, identify medical management, formulate a nursing care plan, differentiate between nephrotic and nephritic syndrome. So nephritic syndrome, an acute nephritic syndrome is a syndrome comprising of signs of nephritis. It often occurs in the glomerulonephritis, which is characterized by a thin glomerular basement membrane and small pores in the podocytes of the glomerulus, large enough to permit proteins and red blood cells to pass into urine, yielding proteinuria and hematuria. By contrast, nephrotic syndrome is characterized by only proteins moving into urine. Nephritic syndrome, like nephrotic syndrome, may involve hyperalbuminemia due to protein albumin moving from blood to urine. Causes of nephritic syndrome: children, stroke adolescents, IgA nephropathy, Pegas disease, post-streptococcal glomerulonephritis, hemolytic uremic syndrome, a disease characterized by a triad of hemolytic anemia, anemia caused by destruction of red blood cells, acute kidney failure, in bracket uremia, and a low platelet count, that is thrombocytopenia. Enoch Sconlein purpura, a disorder that causes inflammation and bleeding in the small blood vessels, in joints, skin, intestines, and the kidneys. Adults, good posture syndrome. It is also known as antiglomerular basement membrane disease, a rare autoimmune disease in which the antibodies attack the basement membrane in lungs and kidneys, leading to bleeding from the lungs and the kidney failure. SLE, that is systemic lupus erythematosus, an autoimmune disease in the body where the body attacks its system mistakenly. Rapidly progressing glomerulonephritis, infective endocarditis. Pathophysiology: thin glomerular basement membrane with pores that allow protein and blood into the tubule. Pathophysiology: we see the pathogenesis there: infection by streptococci, immune complexes, antigens, activation of complement, recruitment of glycocytes, inflammation, mediates cytokines, proliferative F, GBM damage, blood ingredients leakage, hematuria. GBM means glomerular basal membrane damage. Hematuria, proteinuria, RBC casts. Also, from the inflammation and mediation of cytokines, we will find proliferation of MC. MC means mast cells and endothelial cells, that is EC. Blockage of renal capillaries occurs and decreased GFR. Then we find oliguria, sodium and water retention, hypovolemia. Also, edema occurs, hypertension, and encephalopathy. So clinical manifestation: it's a syndrome. Hematuria, red cell casts, hypertension mild, oliguria, uremia, proteinuria less than 3 grams in 24 hours. Signs and symptoms include hematuria, color colored, proteinuria, hypertension, oliguria, flank pain, general systemic symptoms, post-infectious to 3 hours after strep throat, URTI. Differential diagnosis, malignancy, older patients, UTI, trauma. Investigations, urine dipstick and send sample to lab, urine microscopy, that is red cell cast, blood as usual, plus renal screen, renal ultrasound, renal biopsy, red cell casts, a picture there. Management, conservative, monitor urea and electrolytes, BP, blood pressure, fluid balance, weight, salt and fluid retention restriction, treat underlying cause. Second, medical, diuretics, treat hypertension, corticosteroids, immunosuppression, dialysis. 3, surgical, renal transplant, nursing management. So that's an activity for yourself. Prognosis varies, post-infectious usually resolve by itself. Others can be a bit nasty. So that's a summary there. Nephrotic is massive proteinuria, whereas in nephritic hematuria or red cell casts. Thank you. So next we'll see a video on nephrotic syndrome, then you'll do that activity there. So this basically is the classification, the differentiation rather, of nephrotic and nephritic syndrome. So you can go through that. Thank you.